Welcome to our presentation of the marketing plan for the proposed company, herein called Grace and Mercy Connection. The developers and authors of this plan are DeCandia, Barry Ellis, Tangelia Monroe, Scott Thompson, and myself, Pamela Bohannon. The marketing plan is the main project of our master's programs with Georgia College and State University. Each one of us has a different major. However, we do have a common and shared interest, and that is societal health issues. Okay, we will give you the executive summary. Change? Okay. The executive summary is that we are going to tell you about the company that we have developed for you. I'll describe the company, and each of the other members will describe their sections. In the company, we'll change. Grace and Mercy Connection is a specialized, unique, non-conventional, non-profit intervention program for women who suffer from addiction, homelessness, and abuse. Dr. Burrows, you, and Dr. Satcher have asked us to create this plan for you. Your proposed mission statement is: we facilitate total recovery of women who suffer from addictions, abuse, and homelessness through a holistic approach of individual evaluation, research-based non-conventional therapies, life skills training, and vocational directives. Now, you've given us your core values, which are very important. These are your core values. We strive to give excellent, compassionate care. We act with integrity and honesty in all interactions. We strive to be innovative in treatment modalities for our clients. We offer only therapies which are proven through research base that are effective and safe. We strive to create a balanced environment for your work and a healthy lifestyle for the staff as well as the clients. Your proposed vision is a 5-year vision. What you want to do is to have a template within 5 years that can be reproduced in other locations, not just your startup location, that will service the women with these same types of modalities. Dr. Satcher and Dr. Burrows, you have developed a very unique approach in your medical care and your medical practice. And so all of the credentials that you have, that both of you have combined, will be your entry into the community that you will want to market. And all of those credentials are in your resume. Your organizational philosophy initially is going to be on your product concept. How will you develop your product, and which product and modalities will you especially offer first? After you have developed your product, then you will go into your marketing phase, and that will be contacting those marketing individuals who will be your contributors and your supporters. Your growth strategies then are going to be in outreach. Barry is going to now give us the industry.
Thank you, ma'am. Now, the industry of your company, being an organization that helps women who have been victims of abuse, suffer from addictions, or may be homeless, and you offer non-conventional medical techniques. The company falls into a category of individual, family, and services of the North American industry class system. With the unique nature of nonprofits, it gives rise to competition from two fronts. One source of competition will be from organizations soliciting funds from the same donors or contributors. The second source of competition will be from those who offer similar services to the same group of women. Next slide, please. I'll discuss the growth patterns within the industry. The demand situation for your company is that you're currently in the planning phase. You're not in growth mode. However, the industry itself is growing due to the recession, budget cuts, failing housing market, unemployment, And all these things lead to rises in abuse, addiction, and homelessness. Per capita consumption. Approximately 1 in 4 women will experience domestic violence in their lifetime. Domestic violence results in 2 million injuries and 1,300 deaths nationwide within a year. Rape victims often experience anxiety, guilt, nervousness, phobias, substance abuse, sleep disturbances, depression, alienation, and sexual dysfunction. Women will receive the most benefit from treatment with services sensitive to their needs. These may include women-only therapy groups, female staffs trained to meet basic needs such as child care, job counseling, and family planning. And the growth potential, your company has good opportunity for growth potential. The proposed New York location is good due to the high rates of addiction. A 2009 government study reported 1.8 million adults in New York have reported using illegal drugs at some point in their lives. Thanks. Now, the characteristics of the industry, distribution patterns, and traditional channels. Channels to obtain funding consist of marketing to government agencies, foundations, corporates, and individual contributors. Of these, the Emergency Shelter Grant, provided by Housing and Urban Development, HUD, it provides the homeless with shelter and essential services. Also, there's the Cooperation of Supportive Housing, which is another New York program whose purpose is to help homeless attain stability, skills, and determination, self-determination. And the regulation and control within the industry. Since your company is a business that provides medical services, you must adhere to certain laws such as HIPAA, bylaws, incorporation, tax exemption, and employee tax laws. Some of the public pressures and societal concerns. The stigma attached to anyone suffering from addictions is that they are somehow immoral or maybe weak-willed. This often prevents family, friends, and employers from really finding out what the problem is. And policymakers view drug abusers as untreatable or undeserving of public support. What this can lead to is treatment programs, insurance coverage, and research programs may be underfunded or even abolished altogether. And now we'll have Tangie with the market.
Thank you, Barry. Your market consists of private donors, public grants, and volunteers who respond specifically to this industry. It is very imperative that Grace and Mercy Connections receives funding. Next slide, please. As far as the physical and behavior descriptors, in the U.S. Census of 2000, there were 600,000 people in Washington, D.C., and 19,600,000 people in New York City. Of those populations, about 17% were reported homeless in Washington, D.C., and about 14% in New York. And this indicates two things. One, that Grace and Mercy Connection is needed, and also that Grace and Mercy Connection should be able to get donors. For example, in New York City, there are two philanthropists, Maurice Greenberg and Vartan Gregorian. Maurice Greenberg has donated $1 billion in women's support groups, and Vartan Gregorian has donated $55 million in women's support groups. Also in the District of Columbia, In Street Village hosted a walkathon sponsored by Fannie Mae, and Fannie Mae's challenge to In Street Village was that if In Street Village could register 3,000 walkers, whether it be virtual or actual, then Fannie Mae would donate $50,000, and it was very successful. Next slide. As far as the product alternatives, there are no specific product alternatives to this specific industry, but keep in mind that donors may be willing to donate to other industries and well-known organizations such as Boys Club of America, Goodwill, and or the Salvation Army. I will now turn it over to Brian to discuss competition.
Thank you, Tangi. We'll now look at the competition. We'll look at organizations offering addictive, abuse, and homeless recovery with holistic services for women in New York and Washington, D.C. We loosely define holistic in our paper as a well-balanced program meeting physical, emotional, spiritual, and vocational needs. We'll be looking at companies that have both genders, and we found a couple that have been exclusively women. Next slide, please. The leader in Washington is N Street Village. Started in 1972, it serves 60% of homeless women in the Washington, D.C. area using holistic and conventional approaches. They have community involvement, self-confidence building, personal empowerment programs, and they provide lodging to all of their people. The Challenger is Some, which is Some Others Might Eat, and they also deal with addiction, and they also provide different services and programs that go great with the people they're trying to help. The Follower is Gospel Rescue Ministries, and they deal with substance abuse and recovery. And they are the Follower because they haven't been around as long as these other companies. As far as New York City goes, the leader is Hazelden. They have several locations and they have a budget of $117 million, which is a lot of money to work with when trying to run a nonprofit organization. They deal with addictive recovery and mental health. The Challenger is Teen Challenge Brooklyn, which works with gang members that have addictions to street drugs and also gang violence. And the Follower is Mercy Connections, which deal with addiction, homelessness, abuse, and crime that only deal with women. Next slide, please. Some indirect competitors are Creative Nonviolence. They're a homeless shelter, but they have no services for addiction in their facility. Coalition for the Homeless, they serve food, and they also provide shelter. New York City Rescue, which provides hot meals, and it's the first homeless shelter that was in New York City. Mercy Ministries of America, support and guidance for young women ages 18 to 28. They help women transition from juvenile jail to help them pick up their lives. And also Daybreak, which is a new organization that's going to be started in Central Georgia in January 2012. They're going to be working with other medical centers to provide medical and mental treatment through collaboration. And they're also works with DePaul USA, which is a company that helps sponsor these types of companies. Now I'm going to turn it over to Scott with the general environment.
All right, my name is Scott. I'm going to talk to you about the general environment for this industry. The first one I'm going to talk to you about is economic factors. In September, the U.S. had around 9.1% unemployment rate. This was based on the most recent census. And 8% of those were adult women. Now, New York City itself has about an 8% unemployment rate. The most important factor here, and the most dangerous factor, is the fact that unemployment is lasting greater than 40 weeks. So the time between losing a job and getting your next job is greater than 40 weeks. Now obviously this is really driving homelessness up. It makes it more difficult for you to pay your bills. Now because homelessness is going up, now you have more drug addictions, a lot more stress, and things of that nature. Charitable giving to private organizations has dropped dramatically into this recession because a lot of people don't have as much money to give. However, charitable giving to faith-based organizations dropped initially and it has come back up. So while homelessness is rising, charitable giving is kind of difficult to get right now. It's down considerably. Economists predict that the economy will not significantly improve over the next several years, and there's increasing likelihood of a double-dip recession. The next one I'm going to talk about is political and legal factors. There are several government programs out there that are good for this industry. One, for instance, is the Substance Abuse and Mental Health Service Administration. This is an organization with the government that offers grants for those that are helping with mental services and substance abuse. Another important industry out there is the Center for Disease Control and Prevention, and they provide a lot of great information on assistance with drug rehabilitation. Another organization, of course, is the Housing and Urban Development, or HUD, that we talked about before. And this department provides funding for emergency shelters. If you're going to provide for homelessness, this actually is emergency shelters, and the HUD can provide provide funding for that. Also, as a nonprofit, you're going to have to deal with the IRS by filling out Form 1023 in order to get your tax exemption. Now, we have a lot more details actually in the marketing plan, so I invite you to go and read that on how to get tax exemption. Finally, charitable donations are currently tax deductible, but as a warning, there's some in federal government that are trying to make it so that charitable donations are no longer tax deductible, and that's going to severely impact the ability to get charitable donations. The next I'll talk about is demographics. Now, in New York City, it has approximately 39,000 homeless individuals as counted by the Department of Homeless Services, which actually does a daily count. About 7% of that number is actually completely without shelter. So there's a lot of shelters in New York City, but there's still a lot of people that are not in a shelter. Of the 5 boroughs in New York City, Manhattan has the highest unsheltered unsheltered homeless. Now, shockingly, there are actually more homeless living in the subways of New York City than in Staten Island, Queens, Brooklyn, and Bronx combined. The last one I'll talk about in the general environment is technological influences. Now, technology has greatly improved the ability to count the number of people who are actually homeless or have drug addictions. The other side of the coin is technology has also allowed us to go out and get more funding because we can get our message out there to a larger crowd. So technology is a great influence in this industry. Next slide, please. The next section I'm going to talk to you about is the SWOT analysis. Now, SWOT, of course, stands for Strengths, Weaknesses, Opportunities, and Threats. Now, I'll go ahead and let you know the SWOT that we did was done by multiple individuals in our group. That way we could get the best results, and we didn't result with groupthink and just all coming up with the same solution. So, as a review of what all this stands for, the strengths and weaknesses is an internal factor. These are things that you can contribute to. Opportunities and threats are external factors. These are things that you have no control over. Now, the strengths, the first one I'm going to talk to you about is competitive advantage. Now, the approach you bring to this market is not currently being duplicated in high volume. So it offers something that is new and is fresh. So that's going to give you a great competitive advantage in this industry, regardless of which city you decide to go to. Your medical experiences is obviously a very big strength. You wouldn't want to go into this industry without knowing anything about holistic medicine. So your extensive medical experience gives you great credibility when you're going to go out and try to get solicit funds. Now, the next one is weaknesses. Now, even though you have a great competitive advantage and there's not a lot of other companies giving the services you want to provide, you currently have no share in the market whatsoever. Your name's not out there. Nobody even knows that you exist. So it's going to be very difficult for you to break in, especially when you have these huge organizations out there like N Street Village and others that have these huge budgets. Now, another one we put down, of course, is lack of experience in working in nonprofits. Now, both of you have a lot of experience working in the medical field and even running and working in businesses. However, running a nonprofit is very different than running a for-profit. For instance, in a for-profit, if you bring customers in, your income goes up and hopefully your profitability goes up. However, in a nonprofit, the more patients you bring in actually deducts from how much money you have in your cash reserves. And if you don't have steady contributions coming in financially, then you're going to have a very difficult time serving those patients. You might actually end up having to turn people away because you don't have enough money. Now, the other thing, of course, is when you're talking about charitable giving, that does fluctuate. And so you want to make sure you have a budget that allows for fluctuation. So you want to have some extra cash reserves in the background. Now we're going to go into opportunities. Now, there's a huge opportunity in either New York City or in Washington, D.C., actually in a lot of cities around the country. So there's a very large need in a very large city. Whether you choose one of these, you're going to find lots of opportunities waiting for you, both in the patients that you can serve and also people who would want to contribute financially. Another opportunity is integrating with other industries. And we're actually going to turn this into an action plan later on. But there are many organizations in both locations which serve homeless and the addicted. You can save lots of startup costs by joining with them instead of building your own business from the ground up. Lastly, I'll talk to you about threats. Now, there's a lot of competition out there for donations, and you're going to have a very difficult time competing against large organizations. Organizations like the Salvation Army and Goodwill are huge and have massive marketing budgets. It can be difficult to compete with these large organizations. And lastly, a weakened charitable giving situation. Now, we've already talked about this, but the current economy is severely impacting charitable giving. Now, the next I'm going to talk to you about, next slide please, is financial objectives and the marketing objectives. First, financial objectives. Your financial objectives are to obtain both grant funding and private contributions. Now, the amount of funds that you need would depend on your budget expense. And pardon this will move on in just a moment. Before you can do any of this, you're going to have to incorporate your business and register it with government agencies. You're not going to be able to get any of these grants, anything, if you don't actually have an incorporated business and you're not registered with the government. The business plan is very important, and this is going to be required in order for you to get a lot of the government grants as well. And we're going to discuss how to do a business plan later in this presentation, and actually in the very great detail in the marketing plan. For marketing objectives, your marketing objective is to become the recognized service provider for women suffering with addictions and abuse in either one of these cities that you choose to operate in. Next, I'm going to turn it over to Tangie.
Thank you, Scott. We're not talk about the action plans. The first action plan is the product. We have two products that we're going to discuss, the business plan and the portfolio. The business plan, there are four major aspects to the business plan. First, the business plan should be written as versatile as possible. Since you are in the introductory phase of your service life cycle, and as you grow into your growth and maturity phases, it's very important that as your organization change, so should your business plan. Secondly, the business plan should be kept in a secure and safe location. The business plan is not meant for all eyes, so make sure that you keep it safe and secure. Thirdly, anything worth envisioning is worth writing down. So any brainstorming, any thoughts, any ideas you have about your business should be written down and later incorporated into the business plan. And fourthly, and most importantly, do not let your business plan alter your mission. Your business plan should enhance your mission. The parts of the business plan include the executive summary, the table of contents, the company description, organization and management, marketing analysis and strategies, financials, and finally the appendix. They've been spelled out for you in the marketing plan, but I will highlight the marketing analysis and strategy and the financials. For the marketing analysis and strategy, there are market tests that you want to include in your business plan. And I highly recommend that you do a market test by having a market survey and get the local community involved, whether it's in Washington, D.C. or in New York. You want to make sure that you get the local community involved and see how much they know about alternative medicines or how much they may be willing to donate their time and or finances to your organization. Also, with the financials, there are no historical financial data, as mentioned before. Grace and Mercy Connection is in its introductory phase, but your prospective financials are described here, and this gives a good idea of how much funding you will need just to get started, whether you start from scratch or integrate with another organization. The next product is the portfolio. There are two major parts of the portfolio, the resume and the background. The resume, of course, includes your name, the number of years you've been in Grace and Mercy Connection, education, professional highlights as it pertains to this specific industry and prior employment. And then there's the background. The background should be as extensive as possible and include your biography, recognition in this industry, community involvement, special skills, past track record, achievements in the industry, extent of involvement with the company, any historical and future contributions to this company's success. And be sure that when you write in your portfolio that you quantify as much as possible. If there's a 15% increase, say there was a 15% increase. I will now turn it over to Barry, who will talk about place.
Thank you, Tangie. The place for the action plan, the location, basically has two options. The first option being New York City. Next slide. Your company needs a place where all clients can easily locate you for assistance, or referral agencies that need to locate you. Next slide. Now the target market will be private and professional donors, in particular the New York Women's Foundation. That's an organization that funds other organizations and strategies to uplift women in the New York area. The action to be taken, the first step would be for you to submit an application for a grant from the New York Women's Foundation. Their process takes approximately 11 months. The second thing you can do is to try to pursue availability of the building in time to receive the grant. On the who portion of this action plan, Dr. Satcher and Burrows, you could complete the grant request forms and submit them to the New York Women's Foundation. Also, in lieu of that, submitting a grant request, you could hire a professional grant writer instead. Now, the timing for this plan. This action plan will take up to 1 year. Taking possession of a building and the process of applying and receiving a grant from the New York Women's Foundation, as I said before, could take up to 11 months. The plan evaluation will be effective if you are approved for a grant within 1 year, and also in addition to that, taking possession of a building, getting supplies, utilities, all within 1 year will be a major milestone for the plan. A contingency plan, since one of you is currently located in Washington, D.C., an ultimate plan would be to start your business in Washington, D.C. Next. Now the second location, second action plan, will be to establish an alliance with In Street Village, as we mentioned before, in Washington, D.C. They offer comprehensive services in both emergency and long-term needs, helping women make gains in housing, income, and health and addiction recovery. Next. Now the target market for this plan would be the board members of In Street Village. With this plan, you could learn the nonprofit business from a well-established leader in the industry. The action to be taken, you should contact the executive director of In Street Village to set up a meeting with the board of directors. Also with that, if you partner with In Street Village, you should start learning the ins and outs of the business. Next. Now the who portion of this plan, Dr. Satcher and Burrows, you would contact the board members of In Street Village. You would gain from learning the nonprofit business from one of the leaders in the industry. The timing, you should try and connect with In Street Village as soon as possible. You should establish a timeline within the range of 3 to 4 months to finalize an agreement. And the plan evaluation. This plan will be effective if your company officially partners with In Street Village. However, if no agreement with In Street Village is reached, the plan will be ineffective and a contingency plan should take place. And of course, the contingency plan, the ultimate plan would be for you to move your business to New York City. And now we'll have Brian with the price.
Thank you, Barry. All right, we're going to go over the action plan price, different types of fundraisers that's going to help your company, nonprofit, not business, make some money to start off with. We're going to look at fall golf tournament or spring auction. We're also looking at grant writing associations that'll help you receive grant funds. First, we're going to take a look at the fall golf tournament and the spring auction. Next slide, please. The who is you're going to be marketing to are middle-class citizens with disposable income that are willing to make donations to a charitable event. You're also going to be looking at different companies in the area of your choice that will help to donate for auction items, to raffle off the items, and also live and silent auction items. The timing, the fall golf tournament will be in the fall, in September or October. Obviously up north, you're going to want it in September when the weather's a little bit nicer. And the spring auction will happen around April. So you're going to want to plan a year in advance for each. So right after one happens, you're going to want to start planning for the other. The action to be taken is, again, reach out to different community members and see if they're willing to donate for either the golf tournament or the auction. And then your next job is going to be able to sell foursomes to the golf tournament and tickets to the auction, which foursome to the golf tournament will be $180. So that's not much a person to plan a nice course, and comes with dinner. And then $100 a ticket for the spring auction, which includes dinner for two and drinks, and also the ability to spend money on auction items. You'll want to look at different ways that you can market this product to the community. And then if that doesn't work, you're going to have to look at both of these and decide whether or not it was because marketing wasn't enough. So in that case, you'll want to try both plans over again with different marketing strategies. But if they both didn't work just because of the interest, then you want to scrap both. And if one worked instead of the other, you'll keep one and get rid of the other. Next slide, please. Next, we'll go over grant writing. We looked at two grant writing places, Allied Grant Writers and Resource Associates, which help nonprofit companies to apply for grants. You're going to want to look at grant companies that share the same vision and values as you, and also the same mission. Next slide, please. First, you want to look at hiring an agency, which I just talked about is Allied Grant Writers and Resource Associates. This service can range anywhere from $700 all the way up to $3,500, depending on what type of package you want, how long you want the grant proposal to be, what you want it to entail, and all that other great stuff. You want to start now, first of all, because if you wait too long to start, you won't be able to apply, as most of these grant funding corporations run on cyclical cycles, twice a year usually. So contingency plan, you'll want to look at, if it doesn't work, you want to look at hiring another grant writing association, or you want to look at different grant providers that share different visions and values that are more closely to the ones that you hold. Now I'll turn it over to Scott with promotion.
All right, the final action plan we're going to talk to you about is how to get your name out there, how to promote. Next slide, please. This section gives guidance on promoting your services to those who may provide financial obligations. And step one to promotion is branding. Now, having high brand equity is what brings consumers back to you time and time again. Think Nike. They have their swoosh. Now, the swoosh is very important. When you see a swoosh, you know it's Nike. Same thing with Starbucks. They have a large green sign. You know Starbucks from a distance away. You can see their green mermaid from a long ways away. Now, your goal is to have a brand that is recognizable and unforgettable. We'll talk about creating a brand name, a logo, and a slogan. First of all, the name we've suggested, of course, is Grace and Mercy Connection. Now, you can pick whatever name you like. This is just one that came to mind for us. And this is a sample logo for your organization. Obviously, feel free to create your own. Next slide, please. I'm going to talk to you about actually how you do your branding. First of all, your objective. The objective to branding is to create instant recognition. When somebody sees your brand, they say, ooh, Grace and Mercy Connection. Now, target market. Your target market is those who want to contribute financially. Obviously, you have a target market of patients as well. However, here, our target is to go out and get financial contributions. The actions to take. Our first suggestion is for both of you to volunteer at organizations which provide services in your target market. Now, this seems like it's a little off from what I'm just talking about, but this is very important. You're going to get credibility among those out there, but since you haven't actually worked in a nonprofit before. Both of you have a lot of medical experience, but you don't have a lot of nonprofit experience. So be willing to do whatever is asked of you at whatever area, whatever place you go to volunteer. And this is going to allow you to see the good, the bad, and the ugly of running a nonprofit. Now, again, this is going to give you lots of credibility among the many financial contributors that are out there, because they're going to see that you have experience, and most importantly, they're going to see your heart for women. Next, ensure that the name that we suggested for you works for you, and if not, pick another one. We like it because it describes the services that you offer, Grace and Mercy, and is also easily abbreviated. Whatever you choose, make sure it is easily abbreviated. Also, once you have your name, this is when you create your logo. You want to have your name first and then create your logo based on that. There are services that can help you create a logo, and those are very good services. But whatever you do, whether you do it yourself or use them, remember these things about a logo. First, it should portray your mission in the logo design. When somebody sees your logo, they should say, "That's Grace and Mercy," or whatever your name chooses to be. It should be able to be presented in both color and grayscale without losing its meaning. So if something in there is color, and it has to be color for it to mean something, you probably don't want to use that in the logo. And going on the same lines, it should also not have tiny details that are important that will be missed when it's displayed in a small setting, so like on a business card. Finally, your organization needs a slogan. Now this not only catches people's attention, but I believe most importantly, it rallies people around your mission and your vision. Okay, so not just those out there, not just patients, not just the financial contributors, but the people who work for your organization will really and truly believe and rally around this slogan. Now, a few suggestions that we have are experience freedom again. Another one is where new life begins. And another one that we really like is it's your life, get it back. So these are just a few suggestions. You want to have something like that that really catches someone's attention. Timing. You should look at volunteering almost immediately. You need to get in there and you need to get the experience so you can build that portfolio. Plan on having your brand, your logo, and your slogan ready within 6 months. And this will give you enough time to get that business plan going and to get out there and start getting contributions. Plan evaluation. You can use focus groups to determine if the brand and the logo and the slogan you're using is actually communicating the message that you desire. Recommend surveying any customers who come to you to contribute and ask them how they heard of you. Contingency plan. Well, it is possible to change your name and logo and your slogan. It's not highly recommended. Before you come up with a name and a logo, we highly recommend that that's set in stone. You don't want to lose any brand equity that you may have built up. Now, even if that name and logo may not seem to be doing well, maybe there's something else you can do to fix it. Small changes to a logo is okay. But if you make huge changes, you're going to lose all brand equity, and you're going to have to rebuild that again. So do so very carefully. The next action plan, next slide, we're going to talk about, and we've spoken about it a little bit, is an alliance with another organization. Now, the objective of the alliance is, and of this action, is to achieve an alliance with an organization which already offers services to your target market. The target market for this plan is non-profit organizations, which currently provide homeless relief, abuse, and/or drug addiction rehabilitation for women. So that's your target market. And we recommend In Street Village as one to look at right away if you want to work in the Washington, D.C. area. Their information is provided in detail in our marketing plan. Actions to take. Though we've only recommended one organization by name, this does not limit you from going out to many organizations and partnering with them. Potentially, you could have satellite offices at multiple locations and provide services at each location during different days of the week. So Monday you can be working at In Street Village and Tuesday you're somewhere else. So this action lowers your overall startup costs because you're not going to have to build buildings yourselves. You may have to lease little areas inside of another organization, but you're going to really decrease how much your startup costs are going to be. We recommend creating that portfolio of past work, including patient testimonials. If you have any testimonies, you go back to patients who you've helped with drug abuse or any other types of substance abuse or homelessness, anything that you've helped them with, and you can get them to give a testimony, either written or video. These are great things to go in your portfolio to use to market yourself to these other organizations. Now remember, a great way to market your organization is reminding them that your potential alliance will likely bring in extra funding for their organization as well. And that's definitely a marketable strength. Plan evaluation. Evaluate this plan based on the number of alliances formed and possibly patient success at a location. So if at one location patients aren't really open to the type of service you're offering, maybe they're just the type that come in and eat and leave, they're just looking for a free meal, maybe look at some other locations. But it's very important that you evaluate how well you're being able to serve your patients at a location. And contingency plan, if the alliance is not providing enough market exposure, so if In Street Village is not also marketing you when they're going out and getting funding or when they're talking to the patients, you yourself can go out and launch your own independent advertisement plan as well. Now, if an alliance isn't working with any particular organization, The contingency there, of course, is to just go and find and pursue another alliance with another corporation. Now, I'm going to turn it over to Pam for our conclusion.
Thank you, Scott. Dr. Satcher and Dr. Burrows, we want to thank you for giving us your attention. You requested us to develop a marketing plan that gave you a blueprint for your envisioned company. We hope that we have done that. We thank you for your kind attention, and we wish you well in your new endeavor.